Our final presenters for today, I'd like to welcome to the podium Ariana and Patrick from Miwatj Health to talk about the Miwatj Health Workforce Initiative and share that story with us. So welcome.
First of all, I'd like to acknowledge the traditional custodians of the land on which we meet today. I also want to thank AMSANT for inviting us to present at today's conference. I also want to acknowledge our Miwatj Health team sitting in the audience today, our hardworking employees, our CEO, and importantly, our chairperson of our board and our board of directors. Miwatj Health, for those of you that don't already know, is an independent Aboriginal community-controlled organisation that delivers its services to the East Arnhem region of the Northern Territory. We were incorporated in 1992, and from very humble beginnings over 20 years ago, we grew into a very large and successful organisation, which is what we believe we are today. And the reason that we know that our Aboriginal community-controlled organisation is successful is, as an example, when a mainstream health service was transferred to Aboriginal community control, over a 12-month period, Miwatj Health proved in evidence that there was an increase in access to our clinic of 402%. Again, and that proves that Aboriginal community control works in improving health outcomes to the communities it services. And we've been able to accomplish this with a predominantly Yolngu workforce. Our current workforce is around 130 staff, and approximately 70% of our staff are Yolngu workforce. So, especially over the last 5 to 6 years, the organisation itself has experienced rapid growth. And so what we needed to really look at our workforce in terms of building capacity and sustainability to support this growth and to continue to be successful is to look at an emphasis in particular in increasing our Aboriginal workforce with a focus on succession planning to leadership roles. In fact, this has always been a dream and a vision of our community and our board of directors, and continues to this day. And in fact, everything spoken of in this presentation are their ideas and driven and dedicated by them to achieve this vision and this goal. And so Miwatj Health's strategy to long-term sustainable health program delivery has been to take a longer-term view to Aboriginal workforce development. On this slide on capacity building, you can see the trainees highlighted in brown. Those with certificates or diplomas are green, and the graduate and postgraduates in blue. So we have a training and mentoring process in place which involves the trainees and linking them with the program areas and supported by staff with other qualifications. The next slide that Patrick will go through that shows the high percentage of community-based Yolngu staff at our Nhulunbuy Health Centre in particular. You can see that not only are we building capacity of our workforce, and it's predominantly Yolngu, and is a much more exciting prospect to deliver sustainable health outcomes. So I'll now pass you on to Patrick.
Good afternoon, everyone. Sorry, a bit loud, yeah? One thing I noticed today, we didn't sing a song for AMSANT. So I would like to have everyone sing happy birthday for AMSANT and Congress. Just to liven you up, you know what I mean? So I will start off here. Happy birthday to you. Happy birthday to you. Happy birthday, dear AMSANT and Congress. Happy birthday to you. Hip hip. Hip hip. Hip hip. Good one. Yeah. Just to equalize my nervous system. Yeah. First of all, I'd like to acknowledge the traditional owners, past, present, and future of the Aranda Nation. So my name is Patrick White. I'm from Northeast Arnhem, place called Irkala. I am a young father, a positive role model in the community, and also a band member in a band called East Journey. Hold on, haven't finished. So my position is workforce training officer in Miwatj Health Aboriginal Corporation. My role is to implement and organize training opportunities for AHPs and also support them on their journey. In the Miwatj Health, we have a high expectation from the community, the importance from the community. So the importance from the community are like to be able to have an organization that has a high qualified Yolngu workforce implemented, and to provide comprehensive primary health care for the community by Yolngu people from the community. So, as you can see up here, this is a structure that has been implemented into Miwatj to have a sustainable workforce in the organization. As you can see, all the highlighted on top there in purple, they are all the team leader positions that manage and run programs in the community. And they are all Yolngu that has been trained up to the expertise of the Western, So, underneath, we have all the people that are involved in the programs and also are trained very well to be able to roll out their responsibilities and also pass on their knowledge for the next generation. So in the Miwatj Health, we have a unique system of sustainability in the organization that provides training and ongoing job security for the community and also for the Miwatj region. Yeah, sorry. This is my first time, sorry everyone, bear me. So, just one of my practices. Yeah, for example, the reason why we implemented this system is to have a sustainable workforce, because we have people fly in, fly out, come and go. They're not really making any changes, not building relationship in the community, not building any benefits, any possibility for the people on country. So, in the organization, this structure empowers the Yolngu workforce, and also the team leader program provides I lost it, sorry. The team leader program roles in the clinic are helpful for the staff. It motivates them and also, once again, empowers them. And I guess it's really important to look after the main importance in our community: our identity, our culture, and our future generation. So, how did we do that? We provided any training opportunities, ongoing, to develop any pathways for anyone who wants to be a HP or a clinic manager. So as you can see, most people has achieved their goal. And also giving them the opportunities of real responsibilities of managing their own program, team leader programs, and also real jobs, long-term security in their job in the community. So this presentation is just short because it's nearly time. Actually, it's time now. So thank you very much. Manyak. Thank you, brother.